Welcome to head, face, neck, and eye assessment. So this assessment first procedure is the preparatory phase. So for the preparatory phase, first is you need to wash your hands. And the next one is to prepare all the equipments needed. So the equipments needed are the examination table for storing the equipment, and next one is the examination gown, which is worn by the patient, and next one is the pen light to illuminate or access the part of the body of the patient, and the next one is ball pen. The next one is record form to record or document any findings, and the last one is the gloves for checking any lesions present of the patient to avoid infection. The next procedure is to check the client's identification and condition, and of course to explain to the client the purpose and procedure, and the last one is to close the door or the screen for privacy. Hello sir, good afternoon. My name is Sam F. Bade, your nurse for today. May I know your name, sir?
My name is Arjun Matugas.
Mr. Arjun Matugas. So, Mr. Matugas, sir, our procedure for today is all about head, neck, face, and eye assessment. So, this assessment is to check, sir, if there are any abnormalities in the said parts of your body. So for the next procedure is the performance phase, in which the assessment will start for the head. So for the head, first is you need to observe for the size, shape, and symmetry of the head and scalp of the patient by using the inspection method. And the next one is to palpate and note any deformities of the head of the client, if there are tenderness, depression, lumps, and lesions on the head by using palpation method. And the last one is to check for the hair distribution and hygiene of the head of the patient by using the inspection method. So sir, as I have seen, your head is symmetrical, the size is normal, the shape is normal, and sir, let me palpate you, sir, to check for the lesions. Okay, there are no lesions. There are no depressions, there are no lumps, there are no tenderness of the scalp or the head, and for the hair distribution and hygiene, it is normal and good. So the next assessment is the face assessment, in which the procedure is to inspect the client's facial expression and involuntary movements, and if there are any edemas or masses by using inspection method. So, as I have seen in your face, sir, you have no involuntary movements. Your facial expression is normal. Can you smile for me, sir? And can you raise your eyebrows, sir? Okay, so there are no gushing. So the next assessment is the eyes assessment. So for the eyes assessment, the first procedure is the position and alimentation. So for the position and alimentation of the eyes, first you need to do or stand in front of the client or the patient for inspecting both eyes for position and the alignment by using inspection method. And the next one is inspect the client's eyebrows, noting their quantity or distributions in any scaliness or any abnormalities of the eyebrows by using inspection method. And the next one is to inspect for the position, presence of edema, masses, lesions, and any conditions of the direction of the eyelashes by using inspection method. So sir, as I have observed, the position of your eyes are in the right position. They are aligned both left and right. The eyebrows has no any scaliness in it, and the eyelashes has no any conditions like edema or any bumps or lesions. So the next procedure of the eyes for the position and alimentation is of course to look for the excessive tearing and dryness of the eye using inspection method. And the next one is to expose the sclera and conjunctiva of the patient by using inspection method. And of course, to inspect for the client's cornea of each eye for the opacity and check for the opacities of the client's eye or cornea if there are glaucoma. And next is to inspect for the pupil size, shape, and compare the symmetry. So sir, as I have observed, your eyes are not dry, it is also not teary, so it is normal. Next one is your, may I see sir? The conjunctiva and the sclera are pinkish, which is normal and good. And also the cornea of each eye, both left and eye, the opacity is good. So you are far from glaucoma or any cataract or sa eyes. So your pupil size and shape, it is normal. It ranges from 4 to 6 millimeter, which is normal for the size of an eye of the patient. So the next procedure for the eyes is of course the pupillary response to the light. So this procedure is you need to ask the client to look into the distance and of course to illuminate the side of the eyes. And the next one is to remove the light to observe how the pupillary or the pupil responds to the light. And the next one is to repeat it on the other side, so both left and right of the eye. Okay sir, nato lang ta sa kilid sir, sa layo. Nato lang ta ang mga eyes using pen light. Okay, next side sir. Okay. So the response of his eye to the light is normal. The dilation and constriction is good. And that's how the normal eyes responds to the tube. So the next procedure for the eyes is the coordination of the eye movement. So for this coordination of the eye movement, so the first procedure of this is you need to hold an object at a distance to the client and ask him or her to keep his head still and follow the object with his eyes only. And the next one is to move the objects towards his left and right eye and towards the ceiling and the floor. Okay, sir, kanalatawa na itong involvement, sir. Okay, sir. So, dalang, sir, ipundo lang ato ang head and mata lang ang isunod, sir. Okay. Okay, so the eye movement is it is normal. The coordination of the eyes are normal. Both left and right are coordinating very well to the object. So the next procedure for the eyes is the convergence test. For convergence test, you need to ask the client to follow your finger or any object or pen as you move it in towards the bridge of his nose by using inspection method. Okay sir, follow lang sa ato ang pen sir. Ako na siya i-forward. Okay. So, the convergence of his eyes are normal. He has a normal vision. So, the next assessment is for the neck assessment. So, for the neck assessment, the first procedure is the range of motion. For the range of motion, the first procedure is you need to ask the client to touch the chin to the chest and turn the head to the right and left. Okay, sir, i-touch na ito itong chin to itong chest and reports ako, sir, na siya sakit. Okay, wala rin sakit? Wala. Next, sir, is turn ito itong head left and right. Okay, wala rin sakit, sir? Wala. Next procedure of the ROM or range of motion is you need to try to touch the ear to the shoulder without elevating the shoulders. Okay, sir, i-try na nato, sir, nga i-reach ang atong ears, atong shoulders, madili na siya masaka, sir. Okay, sir? Okay, that's not good, sir. So, dira siya tama, sir. Okay? So, the next is to extend the head backwards and forward. Okay, sir, i-extend nato forward or backward. Forward. Okay, so my assessment for this is the ear to the shoulder is not met because it is because of low siya ganang stretching or maybe sa exercise and maybe tenderness for the neck of the patient. So the next assessment is for the neck is the lymph nodes, checking the lymph nodes. So First is you need to palpate the lymph nodes by using the index or the pads of the index finger and the middle finger. And the next one is examine both sides of the lymph nodes and feel the sequence of the following nodes. Okay, search ang mga tatong lymph nodes. Okay, first is preauricular, parotid, tonsillar, okay, and submental, submandibular, supraclavicular, posterior cervical, okay, deep cervical, and superficial cervical, occipital, and the last one is posterior auricular. That's all. So the lymph nodes are normal, so wala siya nagdikit-dikit, so that is good for the lymph nodes. So second to the last assessment for the neck is the checking for the trachea. So for this assessment, the first procedure is to palpate the trachea shift and place your index finger to the trachea and check for the sternal notch and slip it on the other side by using palpation method. Okay, sir. Nagalang ito ang trachea, sir. Okay, this is the sternal notch. It is a little bit tender. So the trachea is a little bit tender, so the trachea shift is not that moving easily, but it is moving at least. Okay, the next procedure for the neck is checking for the thyroid gland. First is you need to palpate the thyroid gland from behind the patient. That's why I'm here. And for next one is to ask the client to sit up straight, lower the chin, and turn the head slightly to the right. Okay, sir? Okay. Next is using the fingers on your left hand, you need to push the trachea to the right. Trachea to the right. Light pressure only by using palpation method. Next is ask the patient to swallow. Okay, sir, swallow the sir. So checking for swallowing the patient is to feel for the thyroid is most rising up tender to your finger pads. So after palpating the thyroid gland from behind of the patient, now you need to palpate the thyroid from in front of the patient. So now I will be sitting here right in front of the patient and ask the patient or client to lower the head slightly and turn the head slightly to the right. Okay, sir, can I lower na long head like this? Sa right? Okay, sorry. So next is using the thumb on your right hand, you need to push the trachea to the right. Okay, sir? Okay. The trachea shift is a bit tender, as I said earlier. Okay, so that's all for the neck assessment. So that would be all for the head, face, neck, and eyes assessment. So after doing the assessment, you need to wash your hands, of course, and the next one is to document the findings and tell the findings to the client or the patient. So, sir, good afternoon. The assessment is done, sir. So far, I have seen no abnormalities like mga lesions or bumps in body parts. For your head, neck, eyes, and face, sir, normal na siya. But there are only one problem, sir, sa imong neck. Maglisod siya ka ng lihok ang movement niya kay dili kayo siya ma-stretch. So ang ana sir kay kailangan to mag-exercise, especially sa ato ang diri na part, stretching lang po, sir. So everyday dili lang nato pusin ang ato self. So that's all, sir.